What is happening, kids? We are back on the dermatology couch. And man, do we have a doozy of a topic today. We are talking about acne and a new groundbreaking technology that we're one of the first to have at PFrank MD to treat safely and with long-term clearance of chronic inflammatory acne. Now, many of you may be saying, Dr. Frank is talking about acne. He's usually the beauty guru. Why is he talking about this condition? Well, acne is not just a medical condition of the skin. It is one of the most common causes of chronic inflammation of the largest organ of the body. It is one of the most common causes of scarring in patients of all ages of the skin. And it really has such a significant short and long-term impact on the lives of people who suffer from it. Teenagers get it, adult men and women. As we get older, the inflammation takes its toll more and more, decreasing the health of the skin, leading to scarring. And by the time most patients come to my office with chronic acne, they are at their wits' end. They already have marks on their skin. They're trying to get rid of dark spots, red spots, pitted scars, rolling scars, and all these different negative attributes that come along with this skin disease. My first goal, as I say to everybody, before we treat the scarring, the most important thing is to treat the condition. So treating acne is a very serious goal at PFrank MD. Me and all my medical providers take it very, very seriously. I am all for doing the simplest of treatments first: topical therapy, oral therapy, antibiotics, hormone manipulators, things of that nature. And as you have heard from me in the past, I'm also a huge fan of Accutane, a very effective and safe drug that's been around for decade upon decade. Like all medicines, the checks and balances, risks and benefits have to be weighed, because anytime you take an oral medication, it can have some consequences and side effects. But I do believe that Accutane is one of the only potential cures in people with either resistant or scarring acne. I use it quite regularly, but not everyone is a candidate for it. We don't hand it out like water. We try and find what the best treatment for the right patient is, and everyone has a different severity upon a spectrum, and Accutane is certainly one of the big guns in this. But now we finally have, in what I've seen for the first time in my career, a real groundbreaking technology that could affect not only the short-term breakouts, but really the long-term chronic inflammation on the skin, and also potentially start the process of treating some of the scarring. And this is the Aviclear laser. It is a laser that targets sebaceous glands. It's performed in a simple half-hour treatment in the office, done monthly for 3 treatments. We see even at 3, 6, 9 months, people are getting better and better results with very long-term clearance. We're still yet to find out what the maintenance would be, how we're going to combine it with other therapies, and ultimately how we're going to get rid of all the marks of the skin. But I really do believe that treating the condition of acne is so important, because so many people suffer from it, and the chronic inflammation that is caused by it affects the aging process. And it's a skin disease that affects the largest organ of our body and has such an impact not only on the health of the skin, but on the social interaction and impact that we see in ourselves and how we interact with other people. So it's an exciting topic. We'll probably eventually lead this into other treatments like lasers and other novel things for the treatments of scars. But again, beautiful skin is healthy skin. And I'm excited about Aviclear technology. We're going to answer some questions. We're going to get to it, kids. I'll speak to you soon. Does it have to be done once a month? Well, the studies show for the efficacy, it should be done in a certain sequential order. I wouldn't do it once every several months unless you're using some sort of maintenance treatment. But it doesn't have to be to the exact day either. So I think if you do the treatments approximately once a month, you're going to get similar efficacy. Post-treatment care. Well, this is one of the most amazing things. The downtime is very little. There's really not that much to do. I mean, you definitely don't want to go tanning afterwards, and you certainly want to avoid any other acne medicines that may be potentially irritating, like retinoids, benzoyl peroxide, for a few days. but you get pretty much back to life pretty quickly. And again, there's always little individual variations that we discuss with each patient. Can you treat scars? The process started while you're going through the treatment. So we usually just make a game plan. There's no quick fix, short-term answer with scars or acne. So I usually make like a 3 to 6 month game plan for patients when it comes to the overall health of the skin. Will one treatment work? You know what? I think we're learning so much about this technology now. Of course, a lot of the people we're seeing fall more on the moderate to severe end of the spectrum, but absolutely, I think there will be room down the line for people who just have mild acne, for people who just have oily skin. Can you say off-label indications? People who want pore shrinkage. I think there's going to be a lot of room for learning and treating various aspects that involve the visibility and disease of sebaceous glands, which are the target here. So I'm going to leave that one open. We're going to learn so much more. But I think if you really have true inflammatory acne, you got to commit to 3 for sure. Dark skin. Can you treat dark skin? Well, that's the amazing thing. We absolutely can treat darker skin tones. And people with skin of color definitely suffer the repercussions of chronic inflammation. Not worse, but differently. They get a lot of brown spots. So anything that you can do to reduce the inflammation is going to help the brown spots, make it certainly easier for me to get rid of them. So it's really nice to know that we have a laser that is safe for all skin types. I knew this question was coming. I would be really excited about this. Now, I know the company is not going to tell you to treat pregnant people, but you know what? I do a lot of different lasers on pregnant women. We're really only affecting a few, at most 1 millimeter, 2 millimeters into the skin. There should be no effect on a fetus whatsoever, and I am hoping that this is going to be a great treatment because women really do suffer from acne. Some people, half the women, their skin is beautiful when they're pregnant, and that's the stereotype, and then the other half really suffer. And there are very limited topical and oral therapies that can be used. So acne, lasers I've always used for acne during pregnancy, and I do hope that this is going to be one of them. Sun. Can I lay in the sun? Well, all lasers are going to make you a little sun sensitive. You can be a little red. You can be a little puffy for a day. Oddly, I've been surprised how patients have not had much downtime or sun sensitivity for this. But when you have chronic inflammation of the skin from acne, you are sun sensitive. All the topical therapies make you sun sensitive. Any treatment for acne can make you sun sensitive. But I wouldn't say it's like you can't leave your house. But definitely, sun is not helping the breakdown in collagen and scarring and all the things that could come from Accutane. So I wouldn't really plan on being in the sun right after a treatment. And you certainly don't want to do it freshly tan. You don't want to do any treatment tan. A lot of people go to the sun for acne because they think it dries everything up, but there's always this rebound that comes later where it really just makes acne worse. So sun, acne, wouldn't do it. Dr. Frank, does this have downtime? Can I go to a party the next night? What is the recovery? Well, recovery is minimal to none. Some people get a little puffy, a little red. Majority of patients, as I said, they're fine the next day. I would never make promises I can't keep. And I always prepare people for the worst and hope for the best. But the recovery is really nothing with nothing. Dr. Frank, can I continue my other skincare routines and can I put on blush and makeup right after my lip gloss? You can't return to the skincare routines that are irritating serums, retinoids, benzoyl peroxides, anything acne or non-acne, anti-aging, pro-aging that may irritate the skin. But you could put on makeup right away. I kind of like this blush here. It's good. Breakouts. Listen up, people. Any acne treatment can cause breakouts afterwards as it's doing its job. Accutane does it. Retinoids do it. Aviclear can do it. So you got to be patient. You got to let the provider handhold you. We try and do our best. We do have our tricks. And you just got to be patient because it can certainly cause a breakout or two. Nothing to be dissuaded by, but your provider does have to discuss it with you. How long does it take? You got to watch the clock. I would say it's about a 30-minute treatment. and maybe you're in the office for a total of an hour. There's a whole process where you have to degrease the skin, get rid of all the oils, and then you have to hyperhydrate it with water. It's a process. Doesn't mean it's painful or torturous, but we're not rushing here. Give it an hour in the office total, okay? Let me tell you in black and white. Of course it hurts a little bit. Everything hurts a little bit. Nothing is painless. That being said, it should be very, very tolerable. Most patients do not need any there's no topical, there's no type of sedation. Certain areas may be a little bit more sensitive. And again, if you have a lot of inflammation on the face naturally, you could be more sensitive. I haven't had any patients that couldn't tolerate it through. Patients are so happy to start making a real big difference. Let's call it anywhere between a 2 and a 6. Some people see nothing. Others feel a little bit more. Probably the guys. I wouldn't call Aviclear a specific treatment for acne scars. Getting rid of the inflammation, it definitely helps with the redness of acne scars, which is the first step, because the more the inflammation, the longer the redness, the worse the scarring. So it is nice to know that it includes the first step towards treatments, but then I will do anything from fraxel resurfacing, microneedling, microdroplet silicone injections, cross technique with TCA. We're going to get into all these acne scar treatments later. I love treating acne scars. It's very, very fulfilling. It changes lives. It's a process. It takes an art, and it takes a lot of coordination of technology and ingenuity. Are the results permanent? I don't know. Nothing's really permanent, right? Everything takes maintenance. Life is a chronic disease, so is acne. Do I believe this is the first treatment in a long time that gives very long-term clearance without a lot of maintenance and drug-free and irritation-free? Yes, absolutely. But it's unknown the maintenance. It's going to depend on the severity of people, what we're using outside the box, other than just Aviclear. All treatments have the potential for scarring, which is why it's important you have a trained healthcare professional, dermatologist, who coordinate care, handhold you through this treatment, through any at-home treatments or anything else that's going to contribute to the health of your skin. This is not a one-off med spa procedure by someone who took a 6-week course on using being a laser surgeon, kids. This is an advanced dermatological treatment. Absolutely, you can do this in conjunction with other lasers. Cryotherapy, laser genesis, V-beam treatments, aerolays. Man, there's just a wide array of things we can do. We're just putting this in the tool belt with the other fun combo treatments we do at PFrankMD. Ooh-wee! Those were a lot of questions, guys and gals. But you know what? I'm jazzed about it. I love treating acne, always have. There's such a huge spectrum of the disease out there on every part of the body. And I love it when people come to me and I could find that combination, that niche of treatment to really do something that sets the course of disease apart from all the other various treatments that they've tried before. It makes such a big impact on people's lives. I don't think the healthcare community takes it serious enough. It's just acne, they'll just grow out of it. But again, like I said, it's the largest organ of the body. And, if you had chronic inflammation of the lung, you would do anything to get rid of it. Chronic inflammation of the liver, the kidneys, you would. And I'm just so glad that at PFrankMD we could take this all so seriously and find the right combination of treatments to make a big impact on people.